Kailangan eh. Kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, ano siya dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung pagkaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, nag-dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran eh. So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung advice nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga, pag ano ko ganyan sa CR, yun parang umano lumabas talaga na ano, ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, ano, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako, parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung nag-ano na ako dito, umabot na ng mga 5 days, ganyan, parang nawala yung sakit dito, nawala siya. Parang hindi na ako o ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, ano ko, maganda ang pakiramdam ko. Yung high blood ko, pag ano ko, parang magandang ano, tinanggal ko na yung ano sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na ano, parang maganda ang ano. Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para iano ko para lumakas talaga sa ako ng ano. Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko. 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simple Nature.
Live. Health today, everyone. My name is Jhen Lim, a board-certified pharmacist and one of your health advisors here in Simply Nature. We are an international distributor of food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. Welcome to another empowering session brought to you by Simply Healed Medical Group, where we come together to explore the latest information, tools, and strategies for enhancing our health and well-being. Last week, Thursday, we discussed about, who can remember? Who among you attended? Okay, that's right. We discussed about pathways to healing breast cancer with advancements in treatment and recovery. Now, moving on tonight, we will take the discussion further with evidence-based natural solution for breast cancer. So what are you waiting for? Call in now your mother, sister, auntie, and lola, especially your breast friend. Feel free to ask questions in the comment section at any time. Kahit Tagalog, okay lang po. We'll address as many as we can during our live AMA or Ask Me Anything session at the end. While we honor the 2 exceptional experts with us tonight who will bring unique insights and experience on this subject. First, we have a seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert currently in Singapore. You all know him, it's Mr. Shyan Lim.
Hi, Jen, and greetings to all our viewers. Tonight, I'm coming all the way from Singapore, not from the Philippines. So look forward to the Ask Me Anything segment. Our discussion today is interesting. It's about evidence-based natural solutions for breast cancer. I know many of our viewers always they're looking for completely natural, no chemotherapy kind of solution. So we'll explore that tonight. So I'll hand the time back to Jhen, and I'll see you all later during the Ask Me Anything segment.
Okay, our second esteemed speaker, Dr. Jansen Calalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Calalan is a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holístico, and Simply Healed Medical Group, where he practices integrative oncology. Let's all watch this.
Microalgae is actually considered as a superfood.
Yeah.
It's a complete food. PPARS can actually preserve the bone marrow. One effect that I really like with PPARS is that it's a perfect chemotherapy, radiation therapy support. Do not be afraid of what the results might turn out to be. Because
Great
the
advice.
results that turns out might be life-saving. You just have to take action. That is the first step. Okay? Do not forget to live your life as well. Okay? Enjoy the things that you have right now. Just have faith. It will come to pass.
All right, guys, welcome again to Simply Healed by Simply Nature. And today we have one of our favorite doctors and also one of our most popular doctors, the very capable and also very guapo, Dr. Jansen from Poly Group. So once again, Dr. Jansen, we're so happy to have you on. Our viewers and our patients love you. You always get such a great response. So welcome back.
Hello, Shyan. Hello, everyone. Glad to be here.
Doc, before we even begin, do men get breast cancer as well?
Yes, very rarely though.
Oh, wow. Okay. So this applies to both men and women. So today our topic is going to be about breast cancer. Perhaps you can share your advice, what they can do to minimize their risk for breast cancer based on their age group. If they're young, they're middle-aged and elderly, are there different things that they can do?
Well, of course, depending on age group, there are a lot of things that you can and cannot do. No, but in general, number one is nutrition. Our culture, the Filipino culture, is not really very what you call this plant-based friendly.
Yeah, it's
Yeah,
hard.
it's
to find,
not.
actually.
It's hard. Yeah, it's difficult to find unless you already have made the adjustment. Then it's easy for you to make the what you're already doing. No, but for people who still want to change, the first one is it's a stepwise. It's not really a black and white thing. No? So you can actually lower your risk as the animal protein intake goes down.
After dietary, is exercise important?
Yes.
What kind of
Exercise is also equally important than with diet. No, with exercise you lower the risk for recurrence of cancer.
Oh, so exercise is important to prevent recurrence of cancer.
Yes.
Okay.
Yes. So 30 minutes a day of moderate intensity exercise that will do you a long way already. But of
Wow.
course, you should not stop with just 30 minutes. If you can increase it
Can
to,
go further.
if you can do more, then it would be much better. No? So as you age, of course, mobility decreases. Well, for elderly women, still walking is very important. Physical activity is important. If you can do brisk walking, then good. If you cannot do brisk walking, then go for light walks. When you suspect that you have breast cancer, no, that is when you during your bath, when you feel your breast, you feel some lumps, or there are some skin changes in your breast. Some skin changes are when there's dimpling of the skin, or there is a wound there that is not healing, or you have nipple discharge. So those are some signs. And of course, when you feel your kilikili, okay, there are some lumps. So those are signs of breast cancer. When you feel those signs, or when you have those symptoms, you have to immediately go to a doctor, because breast cancer is really curable. It would be such a waste if you do nothing and then you later realize that, wait, I already have stage 4 breast cancer and it's too late, where in fact you already felt that lump years before and you did nothing. If you are going on a plant-based diet, no, so this means that you are not eating any animal food products already, then vitamin B12 is very important. 50 micrograms once a day or 2,000 micrograms once a week. If you're already 65 years old and up, then take 1,000 micrograms a day. Okay, so
Wow.
that's number one, vitamin B12.
All right.
Then number two is, of course, sunlight is very important. But of course, when your lifestyle is really not out there in the open, you have less of a few sunlight exposure, then you can
Yeah.
take vitamin D3. Vitamin D3, 2,000 international units once a day. That's already okay. And then some patients, when you are already diagnosed with cancer, no, you can also take vitamin C plus zinc. This is to boost your immune system or to keep your immune system at optimal levels, or one capsule twice a day. Yeah, after meals, no. And then the third one is PPARS. Actually, microalgae. Microalgae is actually considered as a superfood. It has
Yeah.
already been studied by, yeah, it's a complete food. It has a complete nutrient, so you won't miss anything. It also has omega-3s, and then its effect is primarily on the metabolism, on your metabolism. So you metabolize fatty acids much faster or easier. So in that way, well, cancer, too much fatty acids kasi in our body produces oxidative stress as well. And it produces inflammation. Typically, patients with breast cancer are on the high or on the heavier weight category.
Oh, okay. More
They tend
mataba.
to, yeah, they tend to have more fat inside their body. So this is one way to metabolize those fats. And then,
Wow.
of course, since PPARS or the microalgae is also a food, it has really very low in calories, but it gives you the proper nutrients that you need. It will also help you lose weight. But of course, you have to do your responsibility as well. One effect that I really like with PPARS is that it's a perfect chemotherapy, radiation therapy support. Because chemotherapy and radiation therapy, yes, it will obliterate cancer cells, whatever cancer cells in your body has, but it also obliterates the healthy cells, particularly the bone marrow. The bone marrow is where your immune cells are incubating. It is where they are maturing. So that when they mature, they get released into the blood. If you destroy that nursery, so to speak, you destroy your chance of developing soldiers. So yeah, your immune system. So PPARS can actually preserve the bone marrow.
Wow. So that sounds like that's the perfect way to go through your chemo so that there will be no reoccurrence. What a perfect combination, Dr. Jansen.
Yeah, it's really a good combination. Yeah.
Thank you for your illumination. Even I feel encouraged today, and I'm a guy. Dr. Jansen just shared so clearly that number one, there's so many women out there who get breast cancer every year. In fact, 30% of cancer by women in Philippines are breast cancer. So if you have it, you're not alone. The good thing about so many people having breast cancer is that the doctors have lots of experience with breast cancer. And so much experience has gone in that defeating breast cancer the first time, if you detect it early, is almost 100%. That is good news. I mean, if you're stage 1 breast cancer, you can be confident that you can be treated well. So our takeaway today is don't ignore any lumps, right? The moment you get lumps, don't be afraid. Don't be afraid, because if breast cancer is detected early, it is treatable. Hallelujah. You don't have to worry. All right. Any last words? Any advice, encouraging words, or words of assurance you want to tell our viewers out there who have or have a loved one with breast cancer?
Number one is don't panic. Just be composed. Yes. It will. It's normal to feel afraid, and it's okay. It's okay to feel bad. Okay, so it's a natural reaction, but do not panic. The next step that you have to do is go see a doctor, so you will be guided. The thing is that you have to take action. Do not be afraid of what the results might turn out to be, because
Great
the
advice.
results that turns out might be life-saving.
Wow, what a powerful.
Might be life-saving, because I have a lot of no, these are family members who did nothing because they were afraid of what the results might turn out to be, and sadly, it was a waste, because would have been they would have been treated. They would have been
They
still
would have survived.
living now. Yes,
Yeah.
they would have still be living now. But then they did nothing. So well, what happened already happened. But nevertheless, it's something that we can learn from. Try to also ask questions with all other with some people that might have similar cases. Try to ask them what their experiences are, so you get to learn from them. Don't be afraid to confront your predicament right now. But just have faith; it will come to pass. You just have to take action. That is the first step. Okay. So
I like.
another one is just try to be positive. No, of course we only have a limited amount of time here in this world. So if you keep on be depressed, right? It would also be a waste, because there's, even with cancer, there's still a lot of things in life that you can be enjoying, even with this pandemic. Yeah, even with this pandemic, there's still a lot of life. There's still a lot of things in life to be grateful for. Okay, so
Wow.
find those things, count your blessings. Okay,
Wow.
so even if yes, you were diagnosed with cancer, or you are suspecting that you have cancer, yes, it seems that all the burden of the world is on your shoulders right now. You are a single mom. You're providing for a lot of for your children who are still very young, and you're the breadwinner, and you were diagnosed with cancer. Even if the burden is too much, try to count your blessings. It will really lift a lot from your shoulders, because then you will be more positive in approaching life. If you are diagnosed with cancer right now, for the next few months or the next few years, it would be all cancer, 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 cancer. Do not forget to live your life as well. Okay? Enjoy the things that you have right now.
Wow, what wonderful, encouraging closing statements. I really like the one that to take action. Take action. Because today, breast cancer is something you can treat well. And today we discuss a new angle many of you probably never heard before, which is prevent the reoccurrence of breast cancer. Because many doctors are confident to defeat cancer the first time. All right, is the recurrence that we've got to stop. And Dr. Jansen shared the strategies. So thank you very much, Dr. Jansen. Again, if you feel lumps or anything, Dr. Jansen is not only a lifestyle medicine doctor, he's also a family doctor. So he can also be that first step, right, Doc?
Yeah,
Yeah, you can
I
go
also
and
work in primary care. Yeah.
yeah, he also works in primary care. So he can be the first step to also refer you to any good general surgeons if you need to. All right. So thank you very much, Dr. Jansen.
Yeah, thank you for having me.
Okay, we look forward to having you again and again and again.
Yeah, sure.
Bye-bye.
Bye.
You have it. There are conventional therapies like surgery, chemotherapy, and radiation, but there's also evidence-based natural solutions such as integrative approaches like nutrition, exercise, and holistic support. Now it's time for our live AMA or Ask Me Anything portion. Let me call back on Mr. Shyan and Dr. Jansen. Good evening,
Hi, Jhen.
gentlemen.
Hi, Jhen. You know, we said that we'll have Dr. Jansen back again and again and again and again. That was older recording. He's really back again and again and again and again. Okay. Yeah. Hi, Doc. So we're coming live from both across Asia. We're coming live from Singapore. We're coming live from Philippines. So to all our viewers out there, big welcome. And we pray that we can answer all your questions tonight. Go, Jhen.
Yes. Let's start the live AMA or Ask Me Anything portion. Actually, there's a leftover question from the previous webinar last week from YouTube. It's from Miss Mary Lou. She asked, is it true that the tumor will shrink
If what?
with PPARS?
If what? If what? If you take action, yeah, the tumor will shrink, right? If you do nothing and just wait, if your tumor is malignant, if it's cancer, the statistics is more likely, it's a safer bet that it will continue to grow and it will get worse. All right. So because your lifestyle and what you're doing allowed the cancer to grow into a tumor. So if you don't change anything, it will keep growing and growing. So yeah, if you make changes, there will be a good chance that your tumor can shrink.
Okay. Next question. I think she's a new viewer, Miss Julieta Cosmiano Hitomo. She's asking, good evening. What can I take? Because right now I'm undergoing chemotherapy.
Oh, doc, this is, there you go.
Yeah, always a combination of an extract and the tablets, no? If you are, I mean, if you're financially okay, I mean, go for the best, which is liquid in the tablets. But if you are in the situation where you have limited resources, you can actually go for the tablets and the soft gel first, then see if see how you respond with the chemotherapy. See how long the chemotherapy side effects last, no? If it's tolerable, then that would be enough, no? There are a lot of other doctors, Simply Nature doctors, who prescribe just tablets and soft gel for their chemotherapy patients, no? But me personally, I always give the best to the patients, for my patients, no? At least. So it's always liquid and tablets. Aside from those, there are other things that you should be also taking in, such as vitamin D3, curcumin, these things. Don't just limit yourself to PPARS alone. Explore other stuff. Use them as a combination. Okay.
Yeah, first thing is I agree with Dr. Jansen, always go for the best because cancer is not a flu or a fever, right? If cancer moves from stage 1, stage 2 to the next stage, which is stage 3 and 4, your survival, and since tonight we talked about breast cancer survival rate, or how shall we say, the rate of the prognosis of you beating your breast cancer is like 90 over percentile, right? So that means it's basically, if you're gonna treat it properly, you're gonna get well. Unless it progresses to stage 3 and 4, then the chances of getting well drops quite dramatically. All right. So always use the best while you have lots of time. All right. So you don't give it any opportunity. And next, I do want to say today's topic is about natural, right? So even if it's natural, when it comes to cancer, me and Doc Jansen don't believe there's one magic bullet. There's no one. Even if you have a wonderful drug that has proven to be working for 80% of the people, it's still not a magic bullet. You still got to do what you can in all other areas because chemotherapy drugs and other approaches to healing cancer has been proven to be successful, but they also still have reoccurrence. So how you go about treating your cancer should be complete from different angles, from a lifestyle change, from supplementation, from natural, to conventional. So don't just do one, right? And if you need help, if you need advice, just arrange for a consult with doctors like Dr. Jansen.
Okay, there you go. Before we move on to the next question, let me just greet one of our avid viewers, Miss Mav Sagot. Welcome po. Okay, this question is shown to us privately. She's asking, when diagnosed with benign breast tumor, when should I consider surgery?
Very good question. Number 1, if the tumor is increasing in size. Number 2, if it's causing pain. Those two.
So you got a direct answer. No need to elaborate anymore. Doc, how about this question? If my if my tumor is benign, can I choose to leave it inside me?
Yes, that's an option. Yeah, just monitor the size.
As long as it's not growing.
Yeah,
Yeah.
as long as it's
Okay.
not growing, I mean, we don't, as much as possible, we do not want to do surgery. Even
Yes.
if you go to a sensible surgeon, the surgeon will also say the same. So one example would be Dr. Jimmy Katapia. He has a lot of patients already. So when you go to him, ask him, Doc, do I need surgery? Um, as much as he can, he doesn't want to do surgery anymore because he has so much. Okay. Yeah. So usually, no, guidelines say if it is benign, there's an option to monitor, or there's an option also to cut it out. So the decision is entirely on the patient, no, during this time. So I have had a lot of patients who decided to just, monitor. So of course, we have to be proactive. We cannot just sit and look at it. Okay? You have to do something, no, something else. So some patients opt for Simply Nature PPARS, and there are patients wherein the benign breast tumors, there was one, no, I talked to her a while ago. 2 centimeter mass shrunk down to less than a centimeter.
Wow.
Yeah.
So, so
How
number
long
one,
was the treatment, Doc?
How long was it? 3 months.
Okay, to
so
shrink
yeah,
one
so even if
centimeter.
you don't operate, you don't do nothing, all right? If you don't operate, then go aggressive on natural integrative methods. Okay? Yeah. Jen?
Okay, to the next question. From Facebook, Miss Precious Joey. I can feel a lump on my left breast about 3 to 4 centimeters in length. It's hard to touch, but I don't want to do surgery. I'm hoping it will be dissolved.
Okay, here's the problem, no. We need to know first if the characteristic, or if the characteristic of the tumor is benign or malignant. Okay, because if the characteristic of the tumor is leaning towards a malignancy, then time is of the essence. The longer you prolong having it removed from your body, the more it becomes problematic in the future. Okay? Treatment protocols become complicated, since the treatment protocol is complicated. There are a lot of complications arising from them. Okay. Also, in terms of survival, it's not that good if you wait, no. If it is malignant, if it is cancer. Okay, so if I were you, although you already told us that it is 3 to 4 centimeter indent already, which is quite substantial, and it is hard. Those are characteristics of a malignancy. So I would do further tests. If you don't want to get a biopsy, okay, fine by me. At least do a CT scan with contrast, just to take a look if the mass is enhancing. Because if it enhances, then it is truly malignant. Okay? So at that point, usually a biopsy would be warranted. However, some surgeons actually would opt for mastectomy right off the bat. Have the entire thing removed and then just perform the histopathology analysis afterwards. No? So the decision of whether, if it is malignant, then of course chemotherapy is always on the table, radiation therapy as well. Um, just decide later on, no, if you will undergo such treatments or not. No, as long as just have the tumor removed first. That's the first goal that you have to do. Okay, because if it is malignant, if you have it removed early on, survival rates shoot up really, really high.
Then you won't have to worry, and it won't be life-threatening in that way also. And for this particular viewer, many viewers, we realize, are very afraid of surgery because they're not updated on the surgery. We have actually met many patients and viewers live, right, during our SMX events. And many of them have not even gone to see the surgeon or ask the surgeon too many questions. So they think that the surgery is very major. But the truth is, today's surgery, the cut is very small, right?
Hmm.
Even a chest surgery doesn't mean they need to cut open your rib cage and force it open like in the past. Just a small 5 centimeter, 3 centimeter is enough. My mother just finished a surgery, doc, she had a, what's that called? A duct connecting from the back of her head, her brain, and then it actually they pull the tube down her neck inside her body, inside her body, and then connected to her GI. So the fluid from her brain is drained directly with a man-made tube in her body into her stomach to get rid of it. And here's the beautiful part: they do it in such a way that if they want to adjust the duct, the pipe, to allow more or less of the fluid to come down, they don't even need to operate on her. They just use a remote and they can adjust it from outside, And the cut here in her abdomen where they did the whole thing is just this, it's like this half the size of my thumb, very small incision. So you can imagine, right? So ask more questions with your surgeon, specifically like, doc, how big is the surgery? How big is the incision? How painful is it going to be? How fast is the operation? The more you find out, actually, the more less afraid you will be. Okay, so that's my advice to you. And if you want the world's friendliest and most caring surgeon, we can recommend you Dr. Jimmy Katapia. And you want a doctor to help you recover after that, Dr. Jansen is here. And especially for those of you who want a consult with Dr. Jansen, because you don't have, unlike surgery, you can talk to him anywhere in the world. So even if you have a relative in Australia, in the US, that they want to consult about their cancer, you can always arrange a teleconsult with Dr. Jansen.
Yeah, so for those of you who wish to have a consult with any of our PPAR partner doctors, including Dr. Jimmy Katapia, a surgical oncologist from Manila Med, or our resident Dr. Jansen Kalalan, our integrative oncologist. The link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Miss Beth and Miss Irish, will reach out to you shortly. Okay, before we go to our next question, let me just greet again one of our avid viewers, Miss Helen Basalio Camonayan. Okay, our next question is related to the previous one, but shown privately. She's asking, which is better and usually done, mastectomy or lumpectomy?
For mastectomy, you have the entire breast removed. For lumpectomy, you just have the tumor removed. Now, there are studies showing that lumpectomy, so lumpectomy is also breast conserving surgery, BCS. If you combine lumpectomy plus radiation therapy, it is actually superior to mastectomy.
Wow. Mastectomy is taking away the whole breast, right? So
whole breast, yes.
Yeah. This improvement in medical procedures, right, everybody? So
okay,
I like, Dr. Jansen, I like what you said. It was not just lumpectomy alone. It's lumpectomy plus radiation therapy is better than just cutting off the whole breast. So again, I think that's in line with what we always share on our Simply Healed program. Don't be locked onto one treatment type only. Do explore to make sure you explore from different angles how to treat your cancer. And that's what we're here to do, to answer your questions. Jhen?
Okay. Our next question is coming from Facebook from Miss Jhen Chan Ang. She's asking, what will be the percentage chances of having breast cancer if most of the female relatives, not immediate family, has breast cancer too?
In the guidelines, if most of the relatives, not the immediate ones, have a history of breast cancer, it is the history of breast cancer is not that strong for this person, okay? So how would I screen you? I would screen you like a regular person with average
Wow,
risk.
that's good news. Good news.
Yeah, so not that high, not that high.
It's immediate family members that is the one that makes your statistics go up. Okay, there you go. For the viewer that asked just now, Precious, I love your name. It's so precious. Okay, Precious, she says she wants to ask for surgery. Who's the doctor and which hospital? Dr. Jimmy is actually the head of the cancer center at Manila Medical City. So just type in and I think Miss Beth or someone will help you connect with Dr. Jimmy, and you can set an appointment. All right.
There you
Jen?
go. And our next question, what are the best natural strategies for preventing breast cancer in women with a family history of the disease?
Oh, so just like everybody else, it's a sensible diet. Okay, sensible diet. Eat real food. Okay, so as much as possible, at least a plant predominant diet. You have to exercise, sleep well. Don't get into vices. Okay, alcohol, smoking, these things. Try to manage your stress. Okay, if you do those things, you'll be able to reduce your risk for developing cancer substantially.
Ah,
There you go.
okay. Okay, now this one. If the benign tumor is removed, will it have a chance to recur? This is benign. What is the best way to prevent it?
Benign tumor, having it removed, is there a chance that it comes back? Very, very small. Very, very small. Chances are it doesn't come back at all. Yeah. Now, how do we prevent benign growths? The answer is I don't know, but I'll give you an educated guess. Okay, an educated guess. So for breast cysts, we're talking about breast cysts. Usually, for the breast, it's hormone related. Okay, so if you're exposed to medications that has hormones, so oral contraceptive pills, no, number one. Number two, if you are eating something that has hormones, dairy products, if you are exposed to materials that act similar to hormones, so these are endocrine disruptors, no, so this affects the balance of your hormone, the physiology of your hormone. Okay, so if you are exposed to these things, then chances of getting an overgrowth, okay, of tissue would be higher. Okay, so I've mentioned endocrine disruptors, so these are substances that when you get exposed to, predisposes you to a lot of toxicities, no, not just cancer, not just tumors, no, other things, no, PCO, PCOS, um, irregular menstruation, reproductive problems, no. These substances are usually very common in personal care products. So your makeup, your facial wash, your soaps, your shampoo, body wash, cookware. Okay, so you have to be wary of these things. So there are a lot of toxins that we can identify among these things. I think it is best that you follow the page of Dr. Yvonne Burkett. Yeah, so she is a toxicologist, a PhD. Okay, she also studied integrative medicine, and her challenge was she had fertility problems when she was 32 years old. She fixed these things, changed her environment totally, and she got pregnant. I just don't know how after a few years probably, no. But go follow her page. You'll be able to learn a lot from her page. But to give you a direct answer now, these some of these endocrine disruptors that you have to watch out for. Number one is plastic. Do not eat food on a plastic container, especially if you heat the food. For coffee drinkers, especially those hot beverages, you'd think that the coffee cup, which is paper, is safe. But no. The reason why the coffee cup does not disintegrate on a hot beverage is because they line them with plastic. Okay? On top of that, the lid that you use is plastic. So if you drink coffee from such a container, watch out. Okay? You are drinking plastics. Now, microwave. Okay. We have microwavable plastics. Also, do not microwave plastic. So if the plastic is heated, no, that seeps into anything that is in the container. So plastic bottles, yeah. So these things, you know them. What else? For personal care products, paraben. Paraben is toxic. It causes cancer. Another one is phthalates. Phthalates, that's the chemical term. The more common term for phthalates is fragrances or perfume. Parfum. French. Pardon for my French. Parfum, perfume, these substances, no. So you have to read the ingredients. No, watch out for these things. What else? What else? Cookware, non-stick. Anything non-stick, toxic. Especially if the manufacturer did not specify what that non-stick thing is. Stay away. Okay. For cookware, the best to use would be cast iron or stainless. Not even aluminum. Aluminum is toxic as well. Okay. I think that's enough. So to allow more time for other questions, but you get what I mean, no? So just follow the YouTube channel of Dr. Yvonne. You'll learn a lot from things that she shares.
You know, Doc, when you share all those list of things, it just goes to explain why so many of us have cancer today. Because even if we don't use non-stick frying pans, for example, the restaurant that you're eating at uses non-stick frying pans. And we are all eating out and things like that. So it's really very difficult. So I want to encourage everyone, from my perspective, there are things that you can do to make your body more unlikely to develop tumors. And since the original question is, will the benign tumors come back again? So the benign tumors came for a reason. If you don't sort out that original reason, it will possibly come back again, right? So just like if you are diabetic and if you got your blood sugar under control, and if you with let's say drugs, and then when you stop taking the drugs and you go back to your old lifestyle, if you didn't change your lifestyle, your diabetes will definitely, your blood sugar will definitely go back up. So I think that's something to take note. I would say supplements that target anti-inflammation or basically help modulate or lower your chronic inflammation will help your body, not promote the growth of tumors. Strengthening your immune system. Honestly, take Simply Nature PPAR tablets. It's going to be good for you for your metabolic syndromes, and once you get your metabolic syndromes under control, you also have a less likelihood of creating foundations and factors that will promote cancer growth. And whatever promotes cancer growth will also promote tumor growth, even if it's just benign. So yeah, that's my addition to what Dr. Jansen has said. So yeah, life
I
is
hope
difficult, right? Yeah.
Mm. I was saying, I hope all our viewers listed down all the ingredients Dr. Johnson said, and then don't
Yep.
forget to bring it when you go to the grocery.
Yes.
You should check every ingredients
Yeah,
na.
you see,
Okay.
I was just taking tablets, I'm not sick. I went to donate blood today, so I had to take iron capsules, you see. So yeah, even today, so even when we do good stuff like do blood donation, supplementation is really like a part and parcel of our life because our diets are not very good. When you go out to the Jolly Jeep to eat, that's going to be terrible, right? That's going to be terrible. So we definitely have to look into areas such as supplementation. Yeah. Jhen.
I think they're getting scared now because the next question is, when is the best time to start monitoring through mammogram, or are there other modality that is less painful?
Yeah, Doc, what's the guidelines?
Yeah, for average risk people, no, so that's just the regular Jane, okay? 45 years old, 45, okay? But nowadays, since I've mentioned all these things that you might get exposure to, 40 years old. Personally, my personal recommendation, but guidelines is 45 years of age, no? So that's mammogram and breast ultrasound. If the tests are positive, no, that means that there are findings, no, then breast ultrasound would have to be done every 6 months. Mammogram would have to be done annually. Okay, so if you have a family history of breast cancer, that would be 35 years of age, especially for BRCA1, BRCA2 mutations. For BRCA1, BRCA2 mutations, that's 25 years old. 25. Okay. If there's a strong family history, this means that immediate family members have breast cancer, history of breast cancer, then 35 years of age. Yeah.
Ah, Oh, okay. Now there's a lot of questions about BRCA from Jansen Ang. Are BRCA1 and BRCA2 gene can also be found in male or
Yes, of
only in
course.
female?
In males as well. In males as well. Males have breasts too, you know. Yeah. We do get
We
breast
like to
cancer
call
as
them
well, you
chest.
know.
We like to call them chest, doc.
Yes,
Alright.
we like to call them chess, of course. We also have that gene. I mean, males do get breast cancer as well. Yeah, so the answer is yes. It can be found in males. And we can actually pass that on to our sons and daughters. It's just a different manifestation. If not breast cancer, then it can be stomach cancer, it can be colon cancer. Yeah, or for females, no, it can not only be breast, but it can also be ovarian cancer.
Okay. Our next question is your patient, Doc, from Janet Tadeo Odon. Good evening to all. Doc Jansen, can I make an appointment with you without having the G6PD test before I had my checkup with you, but not able to come back for follow-up? Naka, ma'am, ha? I have 16 sessions of chemo, and tomorrow will be my 12th session.
I just want to congratulate you first. This
Yay.
means that if you did not need to follow up with me, then
You're
you
doing
must be
good.
doing well. Okay? You must be doing well. So if you want to talk, no, you don't need the G6PD test to follow up. The G6PD test, I only require that if the patient is going to undergo high dose intravenous vitamin C or ozone therapy, especially ozone therapy administered directly to the blood. Okay. But I mean, if you just want to talk to me for other matters, then go ahead and schedule an appointment.
I'm sure Doc Johnson will be looking forward to meeting you. Doc Johnson is one of those doctors that actually enjoy meeting his patients. Yeah,
Okay.
Jen,
Next question from Facebook, Miss Christine Banog. Can PPARS also help reduce the symptoms of polycystic kidneys and liver?
Yes, for polycystic kidneys, it can because it reduces the burden on the kidneys to process protein. It helps reduce inflammation. So definitely yes. But if you have polycystic kidneys, be careful because if you have polycystic kidneys, chances are you're going to dialysis later on in your life. You have to be careful. If your liver has plenty of cysts, go see your doctor. It's also not a good idea, but polycystic liver, polycystic livers, no, fare better than polycystic kidney because polycystic kidneys usually they go into dialysis later on in their life.
Okay, next question is a PPARS question. When is the best time to drink liquid PPARS with my maintenance medication for high blood sugar?
I would space them out. So this means that if you're taking your blood sugar medications in the morning, then just take PPARS at night. That's fine. If you are someone who has plenty of tablets to take, then I would take PPARS in at noontime. So if you have medications you have to take in the morning and in the evening, then I shift them at noon. PPARS and medications can be taken together. My personal take is just that I seldomly advise patients to take PPARS together with food. But that's just me. I don't know with the recommendation of the manufacturer.
actually, we also don't recommend taking the PPARs with food because we just want you to absorb the PPAR without dilution, without it being diluted. So that's the main reason. But if you forgot your timing, it's better to take it with food than not to take it, right? If you were supposed to take it in the morning and now, oh no, it's 11:30, I'm going to eat my lunch. It's better to take it than not to take it. But ideally, we would like you to take it, especially for the extracts, without not together with food, so that your body will absorb it without dilution, without being diluted or mixed with food. Not that there's any intraindication, it's just that it's not cheap. So we want you to absorb it fully. Yeah. Doc, for diabetic patients, just want to ask a question. When is the time where blood sugar really builds up in the body? So for a diabetic patient, is it important to get their body's sugar level back to normal in the morning, or to prep up the body in the evening for whole night? I mean, yeah.
So sugar increases, of course, during daytime. Because
Okay.
aside from the patient eating, the patient would also be awake. So you have cortisol's effect as well. So
Okay.
it's usually your medications, majority of them have to be taken during the daytime. There would be very small amounts during evening. I usually give anti-diabetic medications in the evening if the patient has bad side effects, so that the patient would be asleep. When the patient wakes up, the side effects would not be that bad already. So that just to give the patient, just to increase the tolerability of the medication. But usually most of the time, no, me personally, and even with other doctors that I have encountered with my patients, they usually prescribe majority of the anti-diabetic medications during daytime.
Okay. So it's also important in the morning, right, to get rid of the sugar that has built up throughout the night. Yeah. All right.
Yeah.
Thank you, Doc.
Okay, next question from Facebook, Miss June Morales. This is kind of big. What can I drink when I have a lump in my breast?
Oh, depends on if the breast mass is benign or malignant. The answer to your question is very, very long.
Go for a consult. Doc, give us a quick one so that we can answer other questions as well.
Other questions, yeah. Again, we've discussed a while ago if the breast mass is benign. So usually it's because of toxicities. So you just have to detox. So aside from PPARS, I also give my patients a detox program. So it consists of a tea, serapeptase, and probiotics. I give them that for 6 months, no, together with PPARS. This was the protocol that my patient took, no, who had that benign breast mass. 2 centimeters shrunk down to less than a centimeter.
Wow.
The mass was not palpable anymore. Yeah, she did 2 ultrasounds, one in Maxicare and another one in, I forgot the name of the hospital. Both results showed less than of a centimeter of cysts. Actually, it was cysts already. It's not even a mass anymore.
Wow.
So that's one. If it is cancer, then it would be more complicated. So for breast cancer, typically, the first goal would be to remove the tumor. So after removing the tumor, chemotherapy, radiation therapy will come. On my part, I give patients supplements, no, PPARS. I also give patients lentin. Lentin is a rice bran supplement, rice bran arabinoxylan compound. No? It's a rice bran that was processed using shiitake mushroom enzymes. Other ones like vitamin D3, some multivitamins that has all the nutrients that would be good for cancer patients. So I give them those. I also repurpose medications, use them off-label for cancer. Okay. What else? Yeah, I think I mentioned everything.
Yeah.
Okay, moving on to the next question coming from Viver from Miss Mary Jane Ortiz with diagnosed with breast cancer stage 4, no surgery, but will undergo chemotherapy on November 18. So that was okay. Her question is, I want to try PPARS, but I am allergic on seafoods.
Oh,
It's not seafood.
it's not seafood. In fact, it will help your allergy against seafood because there's an immunodeficiency. So absolutely nothing holding you back. Quick please quickly go and take PPARS because you have started your chemotherapy sessions already. It's going to help you a lot. Number one, it's going to help you maintain your RBC count. And that's going to be critical for you to stay on schedule for your chemotherapy so that you will have an effective and, how shall we say, stable chemotherapy cycles. Yeah.
Another inquiry coming from our inbox. How to administer PPARS tablets if the patient is on NGT?
Crush them,
Yeah.
then mix it in water, then give it.
Yes,
Okay.
correct.
Water. Okay, next question. What are the PPARS options safe for breast cancer prevention?
All are. They all are.
Safer.
Yeah. So if you're financially very, very strong and you are so worried because your immediate family members are all have breast cancer, I would suggest you do something like start with a powder jar first, and then maybe take that once every 6 months, right? And then take tablets every day together with it. Don't worry, you're not only gonna help prevent cancer, lower your chances of getting cancer, you're also going to improve your metabolic syndromes, your blood sugar, everything is gonna go down. You're gonna feel more energetic, and because you're a lady, the next effect is gonna be very good. Your skin's gonna glow, all right? Because PPAR helps with cell delineation. It also makes sure that your new skin is actually healthier than the old one. So one of the wonderful side benefits of taking PPARS is you look wonderful. One of Doc Jansen's patients, right? Doc, the one with the tongue cancer is yours, right?
Yeah, yes.
Yeah. Her testimony is she's so happy her tongue cancer as well, but she keeps saying, my colleagues say my skin looks good. My colleague says my skin looks good. So if you want, if money is not an issue, I recommend that. If not, just take the PPAR tablets. It's going to be one of the best foundational supplements you can take. It's going to help with your metabolic syndromes. It's gonna and with the PPARS inside, although it's a smaller amount compared to the extracts, it's just gonna keep all your immune system, your inflammation, everything in check long term, and that's gonna just help you reduce the chance of ever developing cancer. Yeah.
Okay, next question coming from Facebook, Miss Mary Slessor. Okay, it's kind of long. I can feel breast pain, but I cannot feel to touch assist. Okay, so she's taking 10 tablets of PPARS for prevention in the morning. And the issue is, she also takes hot water by 5 a.m. Okay, so is it okay to take PPARS tablets in the morning around 4 a.m., then eat breakfast by 7 a.m.?
Yeah, sure.
Absolutely.
Yeah.
I just want to say that 10 tablets a day is actually please take more. please take more. If you actually have a fear of cancer, and if you have an anomaly in your body, then let me just share with all viewers, therapeutic, that means to have healing effect. We need to start with minimum 20 micro tablets a day. All right. So 10 is more for really maintenance. You are really healthy and everything is fine. But if you suspect something, then I would start with minimum 20. 30 would be a very comfortable number. It's just very simple to understand. When you feel like you're going to get a flu, you will take more vitamin C tablets, right? Or you drink, what's that?
Beroka?
Boroca, right? You go and buy Boroca and go pop two in the effervescence because you know that you are going to fall sick. Okay, you can feel it coming. So it's the same way. So if there's something that you are concerned about, 10 is only for maintenance. Do take more than that. And then after taking it for like 1 month, okay, go and do some lab test. Do notice your blood sugar, blood cholesterol, your general energy level as well, your health. And of course, does she say that she has no cyst?
Yeah, she cannot feel
She cannot
assist
feel
to
a cyst,
touch.
right?
Yeah.
But she has breast pain.
Mm.
So please observe your breast pain. Does it still occur? after a month of taking PPAR tablets. So for that to have improvement, don't just take 10, all right? Take at least 20, better if you can take 30. So 10, 10, 10, 3 times a day. And then after a month, you know, observe. You don't even have to wait a month. After 10 days, any difference in the pain? Does it get less? Is it less frequent? That will help you know that you're moving in the right direction. And of course, if you're not sure, have a consult with Dr. Jansen.
Yeah, that's her additional question. Can I make an appointment first with Dr. Kalala?
Yes!
Because I don't like Western doctors. Much better
Oh!
if integrative like you.
Wow, okay. And he's not only integrative, he's Eastern.
Okay, we're almost at the end of the webinar. This will be
Yes,
our
yes.
last question for tonight.
All right.
Okay. What is a biopsy and why is it done for breast cancer?
Oh,
Okay, very good, very good. Okay.
question.
Biopsy is when we get a tissue sample from the mass. So that's a biopsy. Okay, so it's a procedure. It's a surgical procedure actually, There are different types of biopsies. So you have your fine needle aspiration, you have your core needle aspiration. For breast cancer, we always do core needle aspiration biopsy. Okay. Sometimes we do excision biopsy if the mass is small enough that it can be removed through excision. Okay. So why do we need to do it? It's so that we are able to know for sure what that tumor is. Is it cancer or is it something else? Okay. So I just want to remind you, I want to remind you, not all breast masses are cancer. There are breast masses that are benign. There are breast abscesses. Abscess, okay? In Tagalog, that's pigsa, okay? Boil, okay? That boil can look like cancer sometimes. So don't panic, all right? Always go see your doctor first, have a proper assessment, before you panic, okay? So, again, a biopsy is when we want to confirm what that mass is, what that tumor is. Is it benign? Is it malignant? If it is malignant, if it is cancer, in other words, what kind of cancer is it? It is. A biopsy will also give us access to more tests, especially staining tests, to help us characterize further the tumor. Why do we do this? It's for us to determine treatment. Okay, especially for the oncos, for the oncologists. So that's important for them. Okay, so there you have it. That's what a biopsy is.
Okay, there we have it. It looks like we've covered all our questions. So as we wrap up this evening, we'd just love to hear your final thoughts for our viewers.
Doc.
Okay. The year is about to end. Okay?
Yeah.
And next month or next week, it's the month of festivities. So for my dear cancer patients, always be careful of the food that you're eating. Okay, you know what is bad for you. You know what is good for you. No one, again, no one will ask you to stop eating this, stop eating that. Okay, it's always up to you. All right, but I am sure when you are faced with that smelly or that fragrant lechon kawali in front of you, you will remember me. Okay, so anyway, kidding aside, have fun, always have fun. Don't always be positive, have a positive mindset. Don't just center your life around cancer. Go do your thing. Okay, go do your thing. If you can, if you're still able to work, go and work. Okay, so this also goes to family members out there who are taking care of cancer patients. If the cancer patient is still strong enough to do exercise, to be productive, to do household chores, let them be. Okay, let them do their stuff. All right, so I think that's it for me. I'll give the floor to Shen.
Same as Dr. Jansen, I want to greet everybody with season's greetings. Merry Christmas and a Happy New Year. As Dr. Jansen said, the holiday season is the season where we meet family. do enjoy yourself, but do be watchful, all right? Especially if you are a cancer patient. Don't let one moment of partying set you back in what you've already accomplished the last few weeks or months. So do take care of what you can and cannot eat, but it is the holiday season. So if you really want to choose wisely and eat those treats that are actually less harmful for cancer patients. So what that is yeah, enjoy all the Christmas treats that are more plant-based, all right? And you know what good news is, you know, Doc Jansen introduced me to the whole concept of plant-based cakes. There are cakes which are no dairy in them, right? So these are chocolate that he actually introduced me a chocolate cake that's totally plant-based, no eggs, no dairy inside, and it actually tastes wonderful. Chef B, one of the celebrity chef, introduced me to cashew cheese. It tastes like mozzarella cheese. In fact, it tastes better than mozzarella cheese, and it doesn't have dairy. So all that is really good for cancer patients. So again, feel free to ask us questions. Good news, even though the holiday seasons is coming, we are still going to be live on. We're going to be there answering your questions. Okay, the only day that we won't be on is the 26th of December. Okay, we've decided to take a break one day out of the whole year. All right, but we are here committed to supporting you. So the other Thursdays, we will still be on to answer your questions. And we just want to wish everybody Merry Christmas and Happy New Year. Thank you very much, Jhen.
Thank you so much to our experts, Mr. Shyan and Dr. Jansen, for sharing their time, knowledge, and experience. And thank you also to our online audience for your thoughtful questions and engagements today. Don't worry, you can still eat lechon, just the healthiest part of it, which is the apple at the end of the mouth. If you have any follow-up questions, we will answer each of your questions next webinar or via direct message. And we hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, it's already December 5. We'll shift gears and go a little technical by triggering cancer death by activating cell apoptosis by PPARS. So congratulations to the raffle winners during our exclusive VIP online meetup via Zoom last November 13. You can claim your raffle prizes until the end of this month only. Along with our current website promos of more than 200 pesos off when you purchase any of our PPARS extracts, including a tri-pack of PPARS soft gel capsules, PPARS powder jar, or PPARS liquid vials. If you'd like more information on how Simply Nature PPARS can be a part of your healing journey, please don't hesitate to reach out via comment or chat. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we're always with you from start to healing.
Junie? Junie? Jhen, can you call Junie? Yeah, I think June. Yeah, okay. It's finished. It's finished. I saw it just ended. All right. Thank you, everyone. Doc, see you soon.
Yeah, see you soon.
So tired, actually. I'm so tired.
Go and rest. Go and rest.
All right. Thank you. Good night, everyone.
Thank you, everyone. Bye.
Okay.
Good night. Bye.